how can we better protect seniors in long-term care homes.
Well, it comes down to money, doesn't it? I have experience in New Zealand. New Zealand has private long-term care facilities. They did not have any, well, they quite clearly didn't have the problems that we've had in Canada, so private facilities can work. Why they failed in Canada, I don't know.
I think they're doing a pretty good job of restricting visitors and keeping them safe and the staff safe as they can. So I think we're doing an okay job right now.
The long-term care homes are understaffed and underfunded, and that's quite clear, particularly when a worker gets sick or has to go off work, they have to be replaced. And when they're not replaced, then mayhem happens in a nursing home, a long-term care home.
Definitely isolate them. Allow only certain family members allowed in, as long as they're isolated. And for example, in London right now, her great-grandmother is actually isolated because a nurse come down with COVID. So that's a very discerning thing when it comes to senior citizens, and she lives in a long-term care.
Well, it's not bad this time because my brother is in a nursing home, and he has a lot of restrictions. I can't even go in to see him, and I'm not allowed to go in to see him. So I think they're doing a lot more. Once bitten, twice shy.
You know, a lot of these things I wasn't aware that there were problems until this. And I guess someone suggested that it's because it's not under the Health Care Act or something. Like, it needs to be part of our national health care where there would be, well, not for profit. I mean, cutting corners and the way, you know, well, obviously these things have come up and they have to be dealt with. So I think, yeah, that's the biggest thing for me.
And that goes again with just continuing to, you know, follow those social distance guidelines and continuing to wear our masks. Yeah.
And yeah, following the protocol.
Mm-hmm.
Sorry, did you want to jump in there too?
Sure. I mean, I think the biggest danger to them would be the workers and the volunteers going in and out. So maybe like mandatory screening for them would go a long way.
Funding and just general awareness. Funding is the big thing, and probably education and training as well.
Daily inspections. Daily, because I've heard in the news there's been a lot of deaths, there's been a lot of neglect, they've been found on the ground, you know, in a mess. So daily inspection, and do not give private enterprise to people to take care of retirement homes.
Taking this more seriously in general and having the PPE. I heard there's a lack of PPE that's really hampered not only Canada but America, but in the United States as well. And that has to be set up.
Don't promulgate regulations and standards and whatever if you're not ready to enforce them. You know, it's as simple as that. And if you find egregious behavior in terms of people not abiding, fine the hell out of them. Fine the hell out of them.
I think personally the way that I've seen people talk about how they're taking care of seniors right now, like I know I have a friend who works in a seniors home, and she sleeps there. She lives there to take care of them, to avoid getting infection, like getting them infected. So I think that's really good. I think that the workers there are really doing a good job. So I think that personally, I don't know what else could be done apart from the great job that they're already doing.
I think that's something that the government needs to look into more. Like, I'm not an expert on that or cannot really comment more, but I think if there are problems, they need to be looked into, and you know, we need to take care of our seniors and make sure that they have proper care.
We need to start removing some of the politicians who just keep the status quo going. Their job is to keep the status quo so that they don't, so that they're not removed from office. But regardless if it's NDP or conservative liberal governments, they've done the same thing with seniors for, like I said, decades. It's been known about, and this brought it to light a bit. But you know what? It's no longer a story. It was a story for a few weeks, but now it's forgotten.
Much more staffing, and that should have been taking place well before the COVID problems.
Well, we have to make sure that the care homes are staffed properly, and Not overworked.
We should have started earlier in the previous 10 years ago or whatever, and trying to predict what things like. I guess we can't do it totally, but that's a major. I have no solution to this, but it's there's I guess it's trying to see things coming instead of reacting to things, I guess.
I have my mother-in-law is in a personal care home, and it took till November the 11th to close that one down. And I won't name which one it was, but very nerve-wracking for the family that goes to visit when they don't really give you enough information. And actually my mother-in-law was quarantined, and they said she had been tested, but she didn't have the COVID. But there was a lot of uncertainty.
It's too late now, but ultimately paying people better wages would probably, and giving people better spaces. In the winter with all the recycled air, I don't know, it's crazy.